Have you ever wondered why so many elderly people lose their teeth? Is it simply because of aging, or is there something more going on? Today, we're going to break down the real reasons behind tooth loss in older adults, and most importantly, how it can be prevented with the right habits and care. Let's begin. First, it's important to understand that losing teeth is not an inevitable part of aging itself. While older adults are more likely to lose teeth, the main causes are actually preventable conditions that develop over time. The most common reason for tooth loss among seniors is periodontal disease, also known as gum disease. This is an infection of the gums and bone that support the teeth. Bacteria from plaque and tartar buildup cause inflammation, gum recession, and destruction of the bone that holds teeth in place. If left untreated, periodontal disease can lead to loose teeth and eventually tooth loss. Periodontal disease often begins slowly. Early signs like bleeding gums, bad breath, or tender gums may go unnoticed, especially because it can be painless in the early stages. As the disease progresses over decades, more severe damage occurs, and the risk of losing teeth increases significantly. Another major factor is tooth decay, cavities that damage the hard surface of the tooth. As we get older, enamel, the protective outer layer of the teeth, can wear down. This makes teeth more vulnerable to decay. In older adults, decay often occurs on the roots of teeth, where the gum has receded and exposed softer tooth surfaces that are easier for bacteria to attack. A key contributor to both gum disease and tooth decay in elderly individuals is dry mouth, medically known as xerostomia. Saliva plays a vital role in protecting teeth. It helps neutralize harmful acids, wash away food particles, and keep bacteria under control. However, many older adults take multiple medications that reduce saliva production, making dry mouth a common issue. Without enough saliva, bacterial acids build up more easily and accelerate tooth decay and gum disease. In addition to these direct dental problems, there are lifestyle and health factors that increase the risk of tooth loss with age. For example, chronic diseases such as diabetes, heart disease, and osteoporosis can weaken the body's ability to fight infection, including infections in the mouth. Smoking and tobacco use also dramatically raise the risk of gum disease and tooth loss. Physical challenges can also play a role. Conditions like arthritis or reduced hand dexterity can make brushing and flossing difficult, and cognitive decline or memory issues can disrupt daily oral hygiene routines. Without good daily care, plaque builds up and dental problems accelerate. So now that we understand the causes, let's talk about how to prevent tooth loss, even in older age. First and most importantly, maintain excellent oral hygiene every day. Brush your teeth twice daily using fluoride toothpaste and floss once a day to remove plaque between the teeth where brushes can't reach. Using an antimicrobial or fluoride mouth rinse can also help reduce harmful bacteria and strengthen enamel. Next, regular dental visits are essential. Professional dental checkups and cleanings, ideally every 6 months or as recommended for your needs, allow dentists to catch problems early before they cause serious damage. Even if you're not experiencing pain, a dentist can spot early signs of gum disease, decay, or other oral health issues that might otherwise go unnoticed. A balanced diet also plays a big role. Eating foods rich in calcium, vitamin D, and phosphorus, like dairy products, leafy greens, and lean proteins, supports strong teeth and healthy gums. Limiting sugary snacks and acidic foods reduces the risk of cavities. Staying hydrated helps maintain saliva flow, which protects teeth naturally. If you or a loved one takes medications that cause dry mouth, talk to your dentist or physician about strategies to increase saliva production or use saliva substitutes. Chewing sugar-free gum or using specialized mouth rinses can also help keep the mouth moist. Quitting smoking and avoiding tobacco products is another powerful preventive step. Tobacco not only increases the risk of gum disease, but also slows healing and reduces blood flow to oral tissues, making infections harder to fight. It's also important to manage chronic health conditions like diabetes. Keeping blood sugar under control and managing overall health reduces inflammation and infection risk throughout the body, including the mouth. Finally, stay aware of changes in your mouth. Symptoms like bleeding gums, persistent bad breath, gum recession, loose teeth, or difficulty chewing are all signs that something needs attention. Early detection and treatment can make a huge difference in preventing further tooth loss. In summary, most elderly tooth loss is not unavoidable. It's usually the result of diseases and risk factors that develop over decades. With conscientious daily dental care, regular professional checkups, a healthy lifestyle, and proactive management of oral health challenges, many people can keep their natural teeth well into their later years. Taking care of your teeth isn't just about a bright smile. It's about better nutrition, confidence, and overall quality of life.